Outside the room, verifying the physician's orders. What else do you want to look for in the chart? Well, you want to see, are they on any anticoagulant therapy, or are there any other specific requirements to this blood gas, such as are they supposed to be on room air, etc., or a certain vent change or something like that. I would kind of glance at their platelets too, to see if their platelets are high or low, just to help with clotting and stuff like that. After you check your order, you verify your order and all that stuff, then you're going to gather your equipment, get two blood gas kits, get specimen labels. You should get labels either from the chart or they should be printed out to that area that your patient's currently at in the hospital. You may or may not get ice depending on your facility. If so, gather the ice and so forth. So I'm going to get my bag here, knock, 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 wash my hands, right? Introduce myself. Hi, I'm Don from Respiratory. I'm your respiratory therapist today, and the doctor's ordered me to get some blood here. It's a arterial blood sample, so we can see how well your lungs are doing. Have you ever had an arterial blood gas before? All right. So our primary site, I'm getting the gloves a little bit tighter. The primary site that we use is the radial artery, which is right here. So it's a little bit different than where you usually get blood, but it's the best place for us to get blood. And this glove is too small, but let's just go with it, maybe. Hold on, I gotta get gloves. There's the glove. Make sure your gloves are nice and tight so that you have nice contact and it's not super baggy on your fingers. So your feeling fingers need to be checked right here. So I'd go ahead and get the kit ready. Probably outside the room is generally when I do it. But you'd set it all up once you have it somewhat ready. Remember to push the plunger. You don't want to be by your patient going, is this bothering you? You know what I mean? So just try to keep it as casual as possible. And if you have everything prepped, then that makes it a lot easier. This ready. I'm gonna go ahead and do alcohol, is that right? So we'll have the alcohol ready. The gauze. Like I said, this would be ice if we need ice. A lot of times you just don't use ice anymore. Alright, so I got everything ready. Now I'm just going to feel your pulses here. Check both sides. Are you right-handed? Okay. If they're both equal, do the non-dominant hand. Might grab a pillow for comfort and for positioning. And now I'm going to do a quick circulation test here. It's called a modified Allen's test. So I'm going to occlude these two arteries here. If you would, squeeze your hand and then let up. Squeeze, let up, squeeze, let up. One more time, squeeze, and then just relax your hand. Release the ulnar while the radius is still occluded. 5 or 10 seconds, right? Greater than 15 is definitely a no-no. So positive modified Allen's test. So we're good there. Notice I'm not fixating on where I'm going to stick yet. I know approximately where I'm going to stick, so I'm going to clean off the area there, put my gauze, and in real life I would have my syringe ready to go. But for this video purposes, we're going to pretend that the syringe, that the needle is bare there, but for protection we're going to go without that. I'd have probably, if the bed was this low, I'd probably get a chair, or I would raise the bed because I don't want to be squinching over too much. All right. So let's say I had a chair in the room. And I'd have to reorchestrate my table so that I could use the chair, right? So I can go from here. Oh, that's kind of hard to do there, right? It'd be like Twister. So you'd want to organize things in such a way that you're not putting yourself in a bad position, because you're going to have to hold pressure here right after you stick. So once again, the cap is really off this needle because I want to be ready to go right as soon as I find where I'm going to stick. Put this closer by. Bevel's up. Put my hand in their hand. Get where I'm positioned, looking kind of down the path of the artery here. Kind of use the tips of my fingers. I don't know if you can see that on the camera, but I'm using the tips of the pads of my fingers, kind of bouncing around, letting the patient know I'm just feeling right now, but I will let you know before I stick you. So I get the needle right above where I want to go. Don't look at the patient, keep focusing here and go, all right, there's going to be a big pinch, short jab. Advance. As soon as I get a flash, freeze. Let it fill. Let it fill. If it's almost full, I'm going to go to my guys. Pull straight out and apply good pressure. Go straight to the needle. Protective cap here. Pay attention to the time, the sat, and hopefully I'd already looked and saw that they were on the correct oxygen. I'm gonna put it up there. And got a respiratory rate, temperature, and stuff like that beforehand. Then you would unscrew the needle. Put this cap on here while holding good pressure. Squeeze out any air that might be there. Mix the sample. I usually mix a sample for 10 or 15 seconds, just kind of rotating it. I keep it down too, just in case there's air bubbles in the top. All right, put it in the ice if needed. Hold it for what, 10 minutes or 5 minutes on the radio. 10 if they're on anticoagulant therapy. And then if after 5 minutes, look at the clock, after 5 minutes, look at it, feel above and below, looks pretty good. And I usually, if there's no blood on there, I would just fold this guy's up or roll it. Some people roll it. And then put the Band-Aid on. Are you allergic to tape or whatever? So I kind of position this and put the Band-Aid on. All right. If I had changed the bed in any form or fashion, I'd put the bed up. Let's say I had this. Put this back up. Put this back up. Is there any position that you need the bed wise? So just make sure you kind of clean up the way the bed was. Clean up your mess. Make sure the sharps go in the sharps container. Here's something I didn't even mention. If it's this blood bag, the blood bag has to go in a red container. You can't put this type of stuff in regular trash. So it's environmental, anything, even if it's clean, it can't be put in regular trash. All right. So once I throw all this away, put the needles and the sharps where it needs to go. Make sure my syringe is labeled. I had a label that I got, right? And if I need to, I'd label the bag also. Making note of the site location, right? So this will be left radial on room air at 10:25, right? And respiratory rate was 14. And temperature was 98.9. Leave the room, clean up. Here's what I would do. I would put this labeled in here. So you're gonna throw all this away. Pretend that's in the sharps. Throw this in the trash. Wash my hands. Run the blood. Sharp.